My name's Adam Kehler, and I work for Online Business Systems. I'm an information security consultant. And today I wanted to talk about current cybersecurity attacks in healthcare and how to prevent them. All right, so let's start with the threat landscape. So you've got high value information and low maturity and security controls makes for a ripe target for attackers. So it's something that in information security, we constantly have to be looking at new threats and how has the threat landscape changed. For example, we are now seeing this pivot to remote workforce. And as the technology landscape changes, as people get more remote, the attackers change their vectors. And so we have to respond to those changes in attack techniques. So what we're seeing is certainly more COVID-related phishing attacks. So we're seeing so many attacks related to whether it be incentive dollars or promise of a vaccine or some miracle treatment or something, just anything to get you to click on that link. And the attacks are have generally been on the rise in that regard. We've also seen a rapid adoption of telemedicine. I think it's a great model for care for certain situations. But the problem is, as I said before, as we adopt new technologies, the security usually comes later. And one thing we saw right away was that Health and Human Services and the Office for Civil Rights said that we are going to pause enforcement of HIPAA for telemedicine adoption, which is great. It allowed organizations to adopt it readily, get it out there quickly. But the problem is they kind of saw that as a waiver and a get out of jail free card to actually address information security. It requires that you do reasonable and appropriate security, which can make it hard to know when you're complying. So what you need to do is to show that you're compliant is to show that you've addressed these reasonably anticipated threats and put in appropriate security controls. If you can demonstrate that, you are well on your way to being able to demonstrate that. Again, as part of our risk analysis for HIPAA, we're saying we've identified certain threats, and certainly those top 5 threats, because these top 5 threats have been identified as pervasive in healthcare. It would behoove organizations to certainly consider at least these 5 threats. Again, getting back to the HICcup document, these are the top 10 things that they've said can help protect against those 5 threats. And in the document, they actually map these security controls to the specific threats. Step 1 in security is understanding what you have. And you'll see this is a common theme. Make sure you understand, and this might seem intuitive, but many organizations really fail at this step. Really understanding where your network boundaries are, where the boundaries between your trusted and untrusted networks are, and then you can start to protect it. So step 1, take all your medical devices, put them on a dedicated network segment, don't allow them to talk to anything. Then you can look at disabling workstation to workstation communication, because why should my laptop be able to talk to your laptop? It doesn't need to. It's that trying to isolate the malware at the entry point and not allowing it to pivot to other parts of the network. And these are some very effective ways to do that. So now we've talked about the network. Let's move to hardening systems. So the endpoint, the laptop, the workstation, that is what is generally the entry point of a phishing attack. They send you the phishing email. You click on the link or open the attachment, and that maybe takes advantage of a vulnerability or gets you to install some software. And once it's installed on your system, then it starts to try and propagate through the network, whether through file shares or, like I said, scanning the network and whatever your laptop can access, it will try and infiltrate. So what we really want to do is, number 1, protect the endpoint, and then protect the rest of the network from being propagated from that endpoint. Don't run as administrator. If I'm running as administrator and I click on a malicious link, that link has my administrative privileges and can do basically anything on that workstation. If I'm running under a limited account, it will have a lot more work to do. I won't say it's impossible, but it'll have a lot more work to do to try and infiltrate that laptop. The last area referenced by these documents is data recovery. And this is, and I title this, or how to recover from ransomware. Because most times when you see that organizations have paid a ransom, it's because they didn't have proper data recovery security controls in place. So if I get infected by ransomware, which is a high likelihood it's going to happen, and I have proper backups, I can just restore my backups, and away I go. I don't have to pay the ransom. So just to summarize kind of everything is, you can't do and you shouldn't have to do everything in information security. Take a threat-based approach. Look at what your threats are, where your critical information is, and focus your effort against protecting against those threats. Come up with a list of realistic threats and look at the guidance on the effective security controls for protecting against those threats. And certainly, you don't have to reinvent the wheel. Use common frameworks, use healthcare specific industry information, and you should be able to pull together a fairly good plan for addressing reasonable threats in a reasonable and appropriate manner, which is what's required by the HIPAA security rule and is the basis for good information security.